Now we have Srimati Lailavati oration on the topic Immersive Learning in the Simulated Environment. We hereby invite the Honorable Chairpersons, Dr. Avinash Supe Sir, Director, Clinical Governance, Hinduja Hospital, Consultant GI Surgeon, Zen Hospital, Chairpur. And Dr. K.V. Ramprasad Sir, MD Anatomy, Diplomat in Family Medicine, Dean Basic Medical Sciences, Senior Resource Faculty, NMC RCMET, Andhra Medical College, Visakhapatnam. Take over.
So I welcome you all to this Srimati Gopuraju Lailavati Garu Memorial Oration. Reason, and with kindness and compassion, she has helped build up livelihood for all the families in their ashrams. So to deliver this oration, I have with me to deliver this oration. It's indeed a privilege to go through this, the resume of Dr. Dinesh K Badyal sir, who is the Program Director, CMCL Fiber Institute, Convener, NMC Nodal Center, National Convener for Advanced Course in Medical Education, and a member, National Curriculum Committee, NMC, Chairman, Pharmacological Expert Group, BBS CBME 2024 Curriculum, Convener, NMC Expert Group for MD Pharmacology Curriculum, and Editor-in-Chief of National Journal of Pharmacology and Therapeutics. He has a galaxy of awards to his credit, and has been the most prestigious one being Dr. APJ Abdul Kalam Memorial Oration, and to follow suit, Dr. Rita Sood Memorial Oration, and a visiting fellowship by Jefferson University, Philadelphia, a scholarship by German Academic Exchange Service, and Professor G. Acharya Oration, Sri Ganesacharya Memorial Oration, and Emil Gupta Award. So in addition to this, he has a infinite number of publications, out of which only more than 170 are very prominent, and has authored around 4 books. It's indeed an honor to have an oration by Dinesh K Badyal sir. Sir, we welcome you, sir.
Das for Development Medicon and the Institute ASRAM, which they have actually put a lot of efforts, and especially for inviting for this oration. We have talked, as I said, we have a lot of talk around going on digital things, virtual realities. And let's try to immerse into some more learning. And we put together some of these things which Dr. Lata and Sir has said already. We'll focus more on immersive part of that, immersive learning in the simulated environment, how it happens. Usually you will see when you hear this word immersive learning, you assume there are high fidelity graphics, immersive content, 360-degree videos, and virtual reality goggles, which you see very easily nowadays. But it has to be followed by peer debriefing and group discussions. Then where the learning will happen. Otherwise, contents are available a lot, but many times that debriefing and discussions are missing. That is the actual part of this. So you will see this content is one part of teaching learning which we'll use or an assessment, but a lot of other things you need to add on to that. This I realized when my daughter told me 3 years back that we have to go to another city to watch a immersive art gallery, 4D and 5D, which has come to India. Van Gogh, you might have remembered. Many cities they have visited now. So we went for that component, and we were inside at that component, and we actually felt all around yours, it is like that. You feel it, you can see that. And once you are inside that, you don't feel other people, you see what they are depicting there. The history, how they have brought up this artist back who has died very long years back. Now how this art has come alive now in the 3D and 4D structures. It's happening in many cities in India. Van exhibition which is happening in that manner. Then after that, in CMC we had now almost the 2024, the first virtual reality pediatric trauma simulation lab which we have created. Right now we are creating a lot of contents for that, curriculum designing which has happened. We are aligning with the competency of UG and PG curriculum in India. So that's how we are experiencing, we are moving into that, we are hearing about these things a lot. Okay. We experimented some of the earlier thing with this virtual reality lab which we have created. So I am in the OT, there are scenarios, a lot of other scenarios also. There is a fire in the OT, how I will react. So you are virtually in the OT. You can see smoke coming from the door, which door you will choose and all that. So this is immersive learning which is happening. Technologies are many which have been already quoted, which are available. So what is immersive learning is a deeply engaging experimental form, experiential learning using simulated learning environment here. Because simulated we are now adding into that in the immersive learning. So components might include realistic scenarios, sensory engagement. Sir has already shown you something, how we get a feedback from those components. Role plays, teamwork, all those components are part of that. And now when we add to simulated environment, a bit about simulated environment, realistic but controlled settings. You can actually build up all the steps into that. But it is a safe space to learn from mistakes. Examples are many. You might have seen or observed, you might have experienced also, mannequin based. We have already talked about VR, AR, standardized patients, task trainers, hybrid simulations. Those are all coming up. A lot of innovations are happening in this space. So while we are talking about today immersive learning in the medical education using simulated environment, it addresses actually the complexity and safety in the clinical trainings. A lot of scenarios. Every patient is different. So lot of components in each patient you will get in a different types. This bridges the gap between theory and the practice. What you have learned, how you apply in those complex scenarios. This supports active learner-centered approach, and because of we are all have shifted to CBME in most of the sciences except dental, so we are looking at those components. We have learner-centered approaches are there. Boosts confidence of the learner, risk-free learning, team training is other aspects, scalable and repeatable scenarios. Okay. So it means the learner has here a lot of time to do many things. They can upscale it, downscale it based on how they are performing, and then can redo it. Enhance critical thinking and decision making which you are making during that scenario when you are immersed into that. So realism is a lot here. High fidelity you can see when we talk about immersive learning in a simulated environment. Alone simulated environment can be a low fidelity also, but when you add on immersive learning, then they become high fidelity. Definitely lot of interactivity. Multiple people can be there, multiple users can actually join the same simulated environment with the virtual reality. And the cost has come down. Right now, when we were also developing this now in India, the VR sets which you see, the cost has come to around 1300 on the Amazon if you see. It means though those gadgets are not very costly. The most of the expenses are on creating the content which you are using, aligning with what we need in India, what we need in our curriculum. So those scenarios are essential components which we need to develop onto that. For experimental, showing to others, you can use ready-made scenarios, but what we need for our student is, in all the sciences, we need to develop scenarios. Debriefing, which most of you have already developed in your central skill lab, we need to actually align with this. So your virtual reality, augmented realities, alternative realities, mixed realities, all these terms which has come and picked up a lot after COVID-19, that you need to build up in your existing structures. This is possible. Funds are available, cost is coming down. So possible applications of these components. When we say of immersion especially, you have already seen alternate, augmented and virtual. How the immersion increases. You can see immersion increases in the virtual reality, it goes to the highest level. Maybe we are getting more other components also. So if you just see in the alternative reality, you are looking at electronic health record simulations, maybe at lower level of immersion, but immersion keeps on increasing. That is also immersion. Some immersion is there. So immersive learning can happen at many stages. And then the panel management training, going to diagnostic imaging, anatomy physiology education. Most of you have given example of today in India, if you are sitting in your class like this, and I can have a heart. The moment I am rotating, you are sitting in each of your chairs, you have a heart in front of you. Not very costly. One Indian company has made it. And the students can rotate it and see, and accordingly they can ask questions, and teacher can also rotate it, have a bigger size and show them where actually to do. That is already happening. So procedural training and clinical emergency management. Lot of scenarios. Some emergency management, sometimes we are not able to simulate at many places, especially immersive learning. So that happens. So in VR's immersive learning, you have variable auditory, visual and sensory inputs which are there along with that. They create realistic digital representation of the real world. The user interacts. So this is now immersive learning. The user interacts with the virtual world by the head-mounted displays. Motion sensors are there which are helping you at that time. Controllers, keyboards, all the game controllers you might have used earlier, and voice recognition softwares are aiding you when you are immersed into that environment. So degree of immersion, as I have shown you, varies from screen-based, which is lower, to the head-mounted displays. Screen-based can have a range of two appearances, like two-dimensional standard video degree or 360 degrees, or they can be totally, completely computer-generated. Van Gogh example I was giving you, that is 5D sort of thing. Everywhere around you, you get it. Fully immersive virtual reality environments are there, which give you more immersive components. 3D images projected by headset or multiple projectors. Multiple projectors they use for all 3D and 4D. You will not be able to see them the way they place them. Motion controllers to track motion and provide haptic sensing, which is the feedback you need in these components. This feedback allows users to interact with the virtual world. Here the immersion comes. Now user can interact at that time only based on the feedback, while simultaneously blocking the inputs from the real world, which are. So that is the something. So in this way, what you can do is, in immersive learning, you can build all the steps which student might not miss, which sometimes even in the actual patients, because these patients are in a hurry these days, they have already done most of the things. When you go stepwise, maybe you are not able to complete all steps which you think are important during UG and PG learning. So they can take place asynchronously, whenever, wherever. So that is a convenience. Virtual word setting, for example, bronchoscopy suite is available, very commonly used. Hospital room, outpatient placing, so that you can do that. And streamlined integration into everyday education, which we are looking at. Now we are looking at 6 integrated modules which are common, and how we can use that. It's a big opportunity because they are now they are fixed for all of us. Scalability and flexibility we have to use for cost saving and favorable cost utility, which is now happening in India. So some of the examples I'm going to share which are already happening. Procedural training a lot, especially in the surgical specialties. And now also a lot of evidence in non-surgical procedures. Endoscopy training becoming the standard for training for gastroenterology. Cardiology improved performance, for example, in virtual transvenous pacer lead extractions. Bronchoscopy improves both skill acquisition and time to complete. And this education in the bronchoscopy especially affords learner tactile feedback, realistic 3D visualization. Interpersonal education, which we are talking a lot now for 5 or 6 years, because we all work in teams, medical, paramedicals, other people together. So we need to train people on that. So interprofessional models, team working, those skills are coming a bigger way in the immersive learning. And some, not everywhere. For example, CPR, you will see a lot of good reports also, but it is also coming up now. CPR training may be inferior in conferring high quality CPR skills also. So people have compared that also, actual versus immersive learning using simulated environment. Orthopedic surgery, improving both knowledge and practical skills. So there also can be used a lot. Neurophysiological things, this is the actual class thing you can see upper one, where you can actually see what is happening in case of a neurological conditions. We see a lot of cerebrovascular things these days, which are at the top everywhere. We are worried about stroke even at the 40-50 years of age. Here exactly you can find out where is the lesion. Mass disasters, those immersive learning simulations are becoming very, very common. Simulations are already available, now immersive learning into that. That is becoming common. So these highly immersive things which I am showing you, they are very helpful to train resuscitations, clinical reasoning skills, team communication among paramedicals. They are already example being used. And the use of specific medical equipments, new medical equipments, their training also, people are using immersive learning. This can be used actually cloud-based also, so people are saving a lot of money, not physically visiting there. Then virtual reality doctor-patient communication training, virtual standardized patient, VSPs. They are avatar-based representation of humanized standardized patient, which learners can interact. So user can interact with them. So these are effective tool in teaching clinical skills and improving the clinical decision making. So in this way you will see virtual reality, immersive learning, all are increasingly being used in higher education for skills as well as role playing. Some other examples are like cardiac arrest management, delivering bad news, because I know a lot of these competencies are there in the UG and PG curriculum in India right now, medical and other curriculum also. Pediatric emergencies which we are looking up, interprofessional collaboration cases, and augmented reality, sir has already told you, Dr. Datta has also told you, when we superimpose. Some of their example I have seen in the real, some of the institutions they are using. What they bring is, they bring real CT scans or MRI scans of the patients, superimpose here, and they exactly come to know today if they are going for surgery, what are the challenges they will face and how they are going to have their plan B and C ready. So there it helps you a lot. And this we can use in the classes also. In fact, we were trying to use it, but in India, because there were some issues with the use of ultrasound in the education, one state has not allowed now, because otherwise ultrasound, you have so many issues for the birth detection and all those. You don't get permissions. One state in India got a permission for using ultrasound in education. So when you do the ultrasound on those mannequins and virtual reality things, when we talk about augmented reality, other half is actually augmented reality. On the screen you will see, one is actual ultrasound image, the other part will show you augmented reality, how it actually looks in an animated way. So it's also as emerging modality now, alternate reality, user computer generated parallel, as a parallel world as a learning and practice. So virtual world using the real world tools, that happens. Some of the example, a lot of people are using this for other purposes. Second life, just try to go there. Second life, you might have attended some virtual CME or conferences where there is a red carpet, you are going into rooms, which room you are going, everything is there. Immersive learning, you are sitting there in the benches actually, and there are classrooms right now. So Second Life is very commonly used platform. One of that is a commercial platform where they have shown that how we can use it for CMEs, workshops and other components. And this is another example of a screenshot of objects representing lungs in the nursing education. You can see in a bigger format. As Sir said, you can create a bigger image and actually you can then look all the aspects of that. And this is a screenshot of a user interacting with virtual communication scenario by participating in the groups, and the avatar responding to the voice activated user statements. So avatars also respond the way you are trying to interact with them. So medical simulation labs, and for that in your medical simulation lab you can have a managing the cardiac arrest. Some studies are already ready, and some of the feedback which came from the students in this scenario, it felt real. We remembered every step. Remember, we teach them how to manage cardiac arrest in many ways, VLS also, other things also. At the end of the day, when we assess them, we find still there are issues. This type of feedback then you are getting, that I am remembering it for a longer time, I can do it anytime, I can tell people steps at any time. So VR and AR for anatomy and procedural skills, AI-driven simulator for adaptive learning in the immersive, remote virtual simulator, tele-simulation is coming up. In assessment, how we can use immersive learning. Both, there are now the same companies I told you have made them. The same thing you can put into OSCE or OSPE station, and you can use that for that formative and summative assessment. Reflective practice and self-assessment students can do when they are practicing, they are rehearsing. And this you can build up a feedback loop for that. When you were observing at that time how they have done, and when they are doing on the self-assessment, they will all combine it together, because you have all these things documented there. But remember, we need to do a lot of faculty development, and institutional support is needed for immersive learning. So training faculty, some budget of simulations, immersive learning, VR, AR you are thinking about, we need to put them together for immersive simulations. Investment is needed, and we need to integrate into our curriculum, which we have already experienced for the last 6 years. We need to build up further into that. Nobody prevents us from doing this. You can innovate on those components. Setup, if you don't have right now good central skill lab setup, then it might initially cost you a lot. Obviously faculty resistance we have seen, and we already know now how to overcome that. Many steps and strategies have been formed in India. Rural areas, because we are opening many medical colleges and other health institutions in rural areas, some challenges might be there. Even we now feel today internet is an issue in some of those areas. Tech dependency is there, so that will happen, because see, companies also build their things which phase out very fast. You need to replace that. Maybe that is another concern for that. Sometimes what have been seen, although we are very much hyped about these things, the hepatic fidelity which they build up is not performing up to the reality which we are getting. This sometimes seems very artificial. Although you are immersed into that, the moment you get feedback, you feel de-immersed. That is the time you feel you are not connected with that. Similarly, tactile sensations. For example, if you are doing certain intervention, placing a peripheral intravenous catheter or chest compression, which has happened in the CPR, they say it was not coming in the way it should have come out. And then fully immersive nature of VR can provoke cyber sickness, which is a well-identified phenomenon now. Similar to motion sickness, more common in the women, especially in this immersive learning. So symptoms can be nausea, disorientation, postural instability, headaches. Those things are also. We are already struggling with spending more time on these things, and a lot of syndromes and others are already described. So we need to look at low-cost immersive simulation models in our country, and also mobile immersive simulation, because we are using mobiles. Even for ChatGPT, I think less of you are using the laptop than the mobiles. So in fact, we need mobile-based components. Collaborative learning platform. We are a lot. If we look at the number of healthcare institutions in India, if only one institute work on one model, we can have 2,000 models in a year. And nowhere such things are available. Okay, then only one institution focuses on one model only. We can do that. People are trying to generate. We are also trying to have a national platform where we put all these things together, so we don't have to reinvent the wheel again and again. This is needed. Futuristic things, we are looking at holographic simulations, AI tutors and simulations. So shortage of teachers might be taken care of. Virtual patients integrated with the EMR. We need a lot of that emergency rooms trainings. Gamifications you have already told about, and serious games in the education. We have talked about a lot. We have used many of that in the maybe faculty development, and now people are using a lot of gamification in UG and PG education too. We need mixed reality classrooms too. When we are talking about finishing the lectures, traditional lectures, shifting to flipped and others, we need to provide these things. Okay, in my flipped classroom, we need some of these things. And integration to curriculum we need. That is our specific challenge, how we integrate into our CPE curriculum. Competency-based curriculum has come into all the sciences. Cloud, use of cloud for the remote simulations, they are heavy and all, everywhere you don't want to take your labs. Think about something which you can just carry and show it, use in the exams, use in your classrooms, something like that. So immersive learning in simulated environment bridges theory and real world practice. It promotes safer, confident, competent healthcare professionals. It has been found to be useful in competency-based medical education with a limited experience which is there in India. So thank you so much.
Most important. Our challenge today is to see how do we get this technology in our systems and integrate it smoothly into our curriculum. So I think that's the challenge. We have to keep a balance of this technology with actual and the humanness. So I think that's our challenge for next few years, and I'm sure we will do all that. Thank you so much.
Switch off the projector here. So now we'll invite our respected medical superintendent and professor of ENT, Dr. K Badyal. Sir, please, sir. We'll present a token of our affection and gratitude for Dinesh sir from Shantia sir. Please. The memento and the certificate. A big round of applause. Thank you, sir. Shantia sir, please present a token of our affection to our chairperson, Dr. Avinash Supe sir. Please, sir. Sir, Dinesh sir. A big round of applause. Thank you, Avinash sir, for joining us. A certificate too. Thank you so much, sir. To Ram Prasad sir. A round of applause, please. A certificate too, please. All the group photos are taken. Thank you so much, sirs. Thank you, sir. Thank you, sir.